Hi Queens, this is Dr. Nonny, your OBGYN specialist next door and online. Welcome to my YouTube channel. For those who have not subscribed to my YouTube channel, please subscribe so you could have a lot of information regarding your health and be well informed. Turn on your notification button so that you could have all information that you need regarding your health, starting from sexuality to menopause. Today we are going to talk about knowing your internal reproductive organs. Understanding your internal reproductive organs is an important aspect of our reproductive health with regards to our physical, mental, and social well-being in all aspects of our sexual health, ranging from our sexuality, fertility, ranging to contraception, even as we transit to menopause. And this starts from you understanding your internal reproductive organs. Now, a lot of women come to the clinic, they don't even understand the basic principles, or they don't even understand the basic knowledge about their internal reproductive organs. Now, anything can go wrong. As small as you see these organs are, now they function together to ensure our sexuality, our reproduction, all works effectively, including our fertility. So you should understand your internal reproductive organ so you can understand what you probably could look out for when things are not okay. You know when to see the gynecologist, you know the likely diseases that could occur. But the first thing that you should understand first is the internal reproductive organ. So in this video series, Dr. Nonny is going to educate you about your internal reproductive organs and what it actually does. So let's go there. Now, as simple as it is, a cyst in the ovary can increase the chance of you having diabetes, cancer in the womb, and can land you in the hospital. Yes. So you need to understand that as small as some of these organs look, when things go amiss, a lot of things can happen. Now let's start from the ovaries. Now you could see the ovaries, they are almond shaped, sitting just right beside your fallopian tubes. Now, one thing about the ovaries is that the ovaries are egg baskets. Every month, your ovary releases one matured egg. And 15 days about that, if you have about a regular 28-day cycle, within 15 days after your ovary, which is your egg basket, houses hundreds of thousands of eggs. From when you're a child, now changes begin to occur and the eggs begin to come down. That is why as you advance in age, the eggs begin to reduce in quality and quantity. So after the eggs releases a matured egg every month, about 15 days after that, then your period occurs. So every month, if you do release an egg from this egg basket, then you are likely fertile and you have a high chance of being pregnant. Now, the ovaries are not just organs of reproduction. These ovaries, which are your egg basket, they also produce hormones, which are our estrogens and our progesterone, and the female hormone, which is the main female hormone that keeps us feminine as females. They protect our bones, our hearts, and our brains. So a lot of things could happen to the ovaries. I'm going to talk about that in my next videos. Now, that's about the ovaries. That's the main thing you need to know about your ovaries. So diseases could happen to the ovaries like cysts, cancer, abscess. That is for our next video. We are going to explain all of that. These are the fallopian tubes. There are two of them, and they are portals, or they are pathways through which the eggs that are being released from the egg basket every month, it gets to the tubes. You could see it is connected and gets in the womb. Now, when the sperm is released into the VJ, it gets from the VJ and walks in from here, moves into the fallopian tube, fertilizes the egg that is released in the egg basket, and the baby is formed. And then from the embryo that is fertilized in the fallopian tube, it gets into the womb and it begins to grow into a baby seated in the womb. So you could see the function of the fallopian tubes. A lot of things could happen in the fallopian tubes. fluid could be there, infection could be there, abscess could happen. These are all things that could affect your fallopian tubes, and you need to know how this happens. Now let's talk about the womb. This is like the landlord, okay? It is here, you can see the womb. It is pear-shaped and it houses the baby when you get pregnant. Now this womb has 3 layers. It has the inner layer. Here is the lining of the womb. Here is the muzzle layer of the womb, and you have the outside of the womb. A lot of disease conditions could happen in any of these layers of the womb. Commonly, you understand about the fibroids. A lot of things could happen. This is a talk for another day. So you need to understand that this is the womb. It is different from the neck of the womb. The neck of the womb is a door which opens to the VJ, which is the vagina. And the neck of the womb is called the cervix. When you're pregnant, changes happen in the neck of the womb, and it begins to dilate and opens up and allows the head of the baby to come down here. Disease conditions could happen in the neck of the womb, including cancer of the neck of the womb. So, when you go for a cervical cancer screening, this is where they put an instrument from your VJ to take some samples from the neck of the womb. Now we have the vagina, which is the VJ, which is a canal where it connects things from the inside to the outside, especially for young girls who are having sexual exposures without protection. Infection can get in from here, the sperm can get it from here, and when it gets into the womb, a lot of things could happen because there's a connection from inside the womb to the tubes and outside the womb. So things can go wrong just from the VJ. So these are the important aspects of your reproductive health that you should understand about. Now you know the internal reproductive organs that you have. I mentioned again, we have the ovaries, our fallopian tubes, the womb is here, 3 layers of the womb, the inner part of the womb where the baby sits and grows inside. There is a muzzle of the womb where you have fibroids and different kind of disease conditions happens. Then you have the outside of the womb. Then we have the neck of the womb, which is the cervix. Disease can happen there, like cervical cancer. And then we have our VJ, which connects the inside to the outside, and a lot of things could happen here. And so, understanding your internal reproductive organs, different things that could happen, the symptoms of different diseases would help you to get to see your experts and look for help when you need to do so. I hope you have learned something today and consider yourself health informed. So, in my next video, I'm going to discuss about the ovaries and the diseases that can happen to the ovaries, what you should expect, how to avoid one of the disease conditions, and when to see your gynecologist. Like, share, comment, subscribe to my YouTube channel, and tell me exactly what you have learned about your internal reproductive organs. For now, do have a lovely day. Bye.